Okay. And that is very important. And maybe you could tell us a little bit, what are some of the signs and symptoms of osteoporosis? Maybe somebody doesn't realize they may have some of these. And could a fracture ever be a sign of osteoporosis?
Sure, it could. And fortunately, the thing that DEXA does for us is allows us to detect low bone density or osteoporosis before the fracture occurs. A fracture that shouldn't have occurred, if I can put it that way, when the amount of force involved is considered, is a signal and often a diagnostic indicator for osteoporosis. So for example, a person has a fall onto a carpet from a standing height and breaks a hip, almost certainly does have osteoporosis or some other bone disease, because under ordinary circumstances that wouldn't break the bone unless it were fragile. Fortunately, with bone densitometry, and I'm going to go back and complete my answer to your earlier question here.
Sure.
We can detect that in time to prevent many of these fractures. Certainly, women over 65, men over 70, anyone chronically taking prednisone or similar medications, for sure should have a bone density test. Someone who has had a fragility fracture would benefit from a bone density test, because that will help to determine whether this was in fact due to osteoporosis or maybe there's even something else going on. And I think for many women, when they reach menopause, it's an important time to have a bone density test in order to help plan or anticipate whether hormone therapy or something like that needs to be taken into account, because it's just after menopause that we see substantial losses. Now,
As like a pulsar barometer for the state.
yeah, it kind of lets you know where you stand. And if your bone density is in pretty good shape, that's one situation. And if it's low, well, then that may be a consideration in how the menopause is managed. And it's certainly something to keep an eye on during those next few years, because there may be substantial decreases after that if hormone therapy is not used for that or other reasons. With regard to the fragility fractures, I just wanted to mention that about 1/3 of hip fractures occur in men. So that's a good example of the fact that men certainly can develop osteoporosis as well as women.
Just not something we tend to think of typically.
Right.
And if you're just joining us, you are watching In a Heartbeat. I'm Dr. David Bala, your host, and my special guest today is Dr. Henry Bone, and we're talking about osteoporosis. Dr. Bone, moving on a little bit further, are there any medical treatments or medications that may predispose or lead somebody towards osteoporosis? I know you mentioned prednisone.
Well, prednisone and similar medications are extremely useful in the treatment of a number of very serious diseases. So we have to use those medicines sometimes. But it's important to be aware that that type of medication particularly can have an important effect on bone cells, and this should be monitored. And in many cases, we can protect the individual against further bone loss and reduce the risk of fracture by giving a protective medication along with the prednisone or other medicines that's required. Some of the medications that are used to treat patients with breast cancer or prostate cancer are designed to reduce their sex hormone levels, and those medications also accelerate bone loss. And again, we have good evidence that medicines that are available will have an important protective effect and can reduce those rates of bone loss and actually reduce the number of fractures that result.
And that brings an excellent point, because I think that was in the news more recently about how women who have adjuvant therapy for breast cancer are at a higher risk for developing bone fractures. And so there can be treatment that can be given along with that medicine to help to prevent that?
Yes, we have good clinical trials for one of the medicines that was recently introduced. Unfortunately, the FDA did not award a specific indication for that purpose in the United States. Similar trials were conducted for men who are being treated by reducing their testosterone levels for adjuvant treatment of prostate cancer. The European regulatory authorities have approved that type of use on a preventive basis, and I would hope that this will be eventually an FDA-approved use in the U.S. Certainly, these medicines can be prescribed off-label, and many are, but it's helpful with regard to insurance reimbursement and so forth to have the official stamp on it.
Absolutely, and that's important. That's really important to know. So many women are on that type of treatment and medication. Dr. Bone, at what point do you feel osteoporosis should be treated, and what sort of treatments are available?
Well, it's fair to say that not everybody whose bone density is on the low side needs to take a medication. But when we get to the point that the bone density is in the official osteoporosis range, which is usually defined as being about 2.5 standard deviations below the mean for the young adult reference population, which means in the bottom 1 or 2% compared to the young healthy adults. At that point, the risk of fracture is usually high enough to warrant treatment. For many patients, the bone density isn't quite that low, but they may have additional risk factors, including age. The risk of fracture doubles for each 10 years of age.
Oh my goodness.
So that a 70-year-old and an 80-year-old individual might have the same bone density, but the 80-year-old would have a greater risk of fracture, everything else being equal. There are other risk factors that should be taken into account. For example, if one of your parents had a hip fracture, this almost doubles your risk of having a serious fracture. And there are a number of these risk factors. Actually, there's a little computer program that the doctor can access on the internet called FRAX, F-R-A-X, that takes these risk factors and the bone density into account. But sometimes people have risk factors that aren't in the formula, and that's where medical judgment applies. In any case, there are recommendations about the risk level estimated over the next 10 years, and the National Osteoporosis Foundation has made recommendations about when patients should be treated based on their FRAX score. One thing to take into account about that is that that really just looks 10 years ahead, and it may not give a real figure for the lifetime risk. For example, a 60-year-old, a 75-year-old, and a 90-year-old individual might have the same bone density. The 60-year-old would have the lowest risk for the next 10 years, but the highest might have the highest lifetime risk amongst the three, whereas the 90-year-old may actually have the highest risk for the next year, but the lowest risk for lifetime because of diminished life expectancy at that point. So this is something that should not be quite as simple as doing the arithmetic, but involves some discussion between the patient and doctor about long-term expectations and what that patient's looking for, what the physician's best medical advice might be.
Not everything will really follow a formula or a computer program, and we really need the physician's input.
That's very important. One of the other important aspects of physician input in a patient whose bone density test indicates osteoporosis is to evaluate for contributory problems. Vitamin D deficiency is an important one, but there are many possible contributory factors, and nearly half of patients with osteoporosis will have something contributing to the osteoporosis that can be specifically treated.
Let's talk about that. And I'm going to throw out a couple things. What does calcium do for us, and what does vitamin D do for us?
Well, calcium and vitamin D are essential. You can't make concrete without sand, and you can't make bone without calcium. The inner structure of bone is really protein, and it's similar in its composition to gristle or tendon or something like that. But bone specifically absorbs calcium and hardens in the same way that concrete does. It gives a much more rigid structure. So we don't want a flexible skeleton. We want flexible joints, but not flexible bones. And that's a very important ingredient in the bone. Vitamin D is essential for the absorption of calcium by the intestine, and it also has a number of other functions. It's very important to a lot of things that bone cells do out in the bones, and as I mentioned, it's very important for muscle strength. There's more and more indication now that it's important for the regulation of the immune system, and that a number of disorders are more common in patients who have had a lifelong low level of vitamin D. So it's actually a kind of a hot topic these days.
It is, and it's important, they find, in cardiovascular health and men's prostate health and
all kinds of things, breast
disorders.
cancer risk, neurologic disorders, there's a long list. None of them are as well worked out as the skeletal part, but they all look like they are going to be important. Yes.
And I'm going to relate back. I remember I spoke to you over the phone one time. We had shared a mutual patient together, and I had asked you, because as a dermatologist, I'm advising my patients to be protective of the sun, and yet patients and people should have healthy amounts of vitamin D. So I remember the answer you gave me, but I'm going to ask you, what is a safe way to get vitamin D?
Well, as you know very well, the same part of the ultraviolet spectrum that causes skin cancer is the one that stimulates production of vitamin D in the skin. So it's widely advised by the dermatology profession, and I think with good reason, to be cautious about sun exposure, use sunblock, be a little careful about how much time you spend in the sun, and so on. That may not result in sufficient vitamin D for most individuals, so supplementation is really important. And especially in Michigan, our vitamin D levels in individuals that don't take supplemental vitamin D are usually much too low. We have some recent advice from a panel from the Institute of Medicine about taking something like 600 to 800 units of vitamin D. And if that's what an individual takes, it's probably a good idea to have a 25-hydroxy vitamin D level checked during the winter to make sure that that's really sufficient. Many people in Michigan will need quite a bit more than that to maintain a good level, especially if they're heavy or have any digestive problems. Certainly people who have had bariatric surgery with the bypass operations,
yes,
may require many times the average, but this has to be monitored with blood levels. It's critically important to measure those.
And some people need much more vitamin D than others.
That's right.
And are there, maybe just going briefly, our time is kind of running down. Tell us briefly, what are some of the drugs that can help osteoporosis?
Well, our most widely used drugs for osteoporosis are in the bisphosphonate family. These include alendronate, which was sold under the brand name Fosamax, and it includes Fasedronate or Actonel or Altivia, and Boniva, which is a bandronate, Reclast, which is zoledronic acid. These are all similar in their mechanism of action. They are absorbed into the skeleton and have a long effect. There are some other medications. Evista is a drug that has some estrogen-like effects, but is anti-estrogen in some other ways. There's a drug that stimulates bone formation that we use in more severe cases called Forteo or teriparatide. And we have a new drug called Prolia or denosumab that blocks bone breakdown in a manner similar to the bisphosphonates, but by a completely different mechanism and is not absorbed into the bone.
And I would just like our viewers to know, they may not be aware, but Dr. Bone here has been instrumental and studied and researched many of these medications in his research programs before they ever became available to the public. And so he has a vast knowledge of the use indications of all of these. So Dr. Bone, thank you so much for coming on our show and taking time for us, and hopefully maybe sometime I'll have you back if you can make the time. And thank you to our viewers for tuning in as well. We really appreciate the time you spend with us. Have a great day and take good care.